Hello, and welcome to the Beeline, the official podcast of the West Virginia National Guard. I'm Master Sergeant Eugene Christ, a public affairs specialist with your West Virginia National Guard. Today on the show, we have Dr. Clay Marsh, West Virginia Coronavirus Czar, and Vice President and Executive Dean of West Virginia University Health. Colonel Todd Fredricks, Associate Professor of Family Medicine at Ohio University Heritage College of Osteopathic Medicine, and West Virginia National Guard State Surgeon. And Colonel Kermit Heubner, the Aviation Medical Officer with the 772nd Troop Command of the West Virginia Army National Guard, an academic faculty at Wright State University Boonshoft School of Medicine, Department of Emergency Medicine, and at the Department of Military and Emergency Medicine at the Uniformed Service University of Health and Sciences. Welcome, everyone, and thank you for being on the show today.
Thanks. Great to be here with you.
Absolutely.
Well, Dr. Marsh, first Clay, let me thank you for coming on the show today, and because I know you're rather busy. But the first thing I'd like to get to, sir, if you could describe to us what the 3 C's are and why it's vitally important for us moving forward as we're getting more and more excuses to leave the house nowadays to follow them.
Yeah, it's a great question, and we know that as we look around the world at countries that have navigated coming back out again and going from staying in your homes to try to reduce the rate of spread of COVID-19 and get back together, open the businesses back up, open the public transportation back up, that a comparison country for the United States is Japan. And Japan is a country of 127 million people. The United States about 331 million. And when we look at the outcomes from COVID, Japan's been back open again, and they have had fewer than 1,000 deaths total from COVID-19. The U.S., in contrast, is moving toward completely opening, and we know in West Virginia, the governor has made a lot of progress in opening the state, but we have over 110,000 deaths. And when you look at the main difference, there's really a few. Number one is Japan is a mask-wearing culture, and we know that masks, if 80% of people wear, will reduce the reproductive rate of the virus, the spread of the virus, to below 1. Which means the virus is starting to dissipate, is starting to stop, is slowing down. And in Japan, they avoid the 3 C's, as you just rightly alluded to. And those 3 C's are crowds, that when you're with a lot of other people, that gives the virus a greater chance of spreading. Close and constant contacts with other people, particularly people you don't live with, that's another one of the C's. And we know that being exposed to somebody for greater than 15 minutes at 3 to 6 feet or less increases your risk of developing the novel coronavirus if somebody else is infected. And the last C is close spaces. So as we think about indoor spaces versus outdoor spaces. So in Japan, there's secret sauce, and remember, the risk on a population adjusted basis between Japan and the U.S. is only 2% risk of dying from COVID in Japan versus the U.S. And those 3 C's are: don't stay indoors as much as you can avoid it. Don't stay around people that you don't know so well, close contacts for a long period of time, and avoid crowds. And wear your mask. And that should help us get through this COVID coming back out together part.
And I know that the governor talks daily about, how great our numbers are here in the state, and your team and the governor and us as the West Virginia National Guard have worked really hard at educating people. But can you talk a little bit about the metrics and the science behind the spread? And I know there's the World Health Organization has kind of changed their stance on asymptomatic folks. But could you talk to us a little bit about what the current science is about the virus?
Sure. Well, the novel coronavirus or COVID-19 is a really unique and very, very sophisticated virus. And this virus came from animals to people. It is able to spread from people who are infected who don't yet know they're infected. And I'll mention what you asked about the World Health Organization and their comments here recently. But the virus also has a very unique feature, and that feature is it has a repair mechanism. So many viruses and many other coronaviruses don't contain this ability to repair themselves at the genetic level. And therefore, things that cause the virus to be stressed makes the virus start to make mistakes in its genetics and how it reproduces. But this particular virus has an ability to repair those mistakes, and that makes the virus much more hardy and much more stable. So when we look at what spreads the COVID-19 virus, we used to think that it was really important to not touch things, that ultimately we thought the deposition of the virus on surfaces like on countertops or on elevator buttons or on water fountains was a major way that this spread. And I think as we have learned more about the virus, we know that that's still something you should be careful about, washing your hands and not touching your face. But it is clear, I think, today that the virus spreads largely by person-to-person droplet spread. And we know that people that are coughing or sneezing or that are sick that have symptoms of COVID can spread the virus. And so that's something we've talked a lot about, covering your coughs and your sneezes and don't go out if you're sick. But what we're finding out more recently and have found out is that people who have the infection with the COVID virus oftentimes don't know they're infected. And the World Health Organization made a statement, their lead science and infection officer, by saying the people that are truly asymptomatic, which means that through the whole course of being infected with the virus, they never have any symptoms, that those people are not very commonly found, and that they also are people that don't actively spread the virus. Now, that got pushed back by some other people, including Dr. Anthony Fauci, who basically said, yeah, we don't really know all that, and that may be a little bit, getting over your skis to make that statement. But what is probably true is we know today that a relatively small part of the people who are infected with COVID-19 spread the virus to others, and they're called super spreaders. And we know that in every series, every experience from other countries, that they found that a small 1 to 10% of the people infected with COVID do a lot of the spreading. And in South Korea, they found one person who infected over 3,000 people. In Hong Kong, one person led the infection of over 300 people. 8 dance instructors, exercise instructors, I think in Miami, infected 112 people. One person infected 56 out of 62 people at a choir practice in Washington State. And these people can have this pre-symptomatic phase, this phase before they get symptoms where they are infectious. So that is a group of people that don't know they have the virus yet, don't have really any symptoms of the virus. But generally, all these people do get symptoms. And during the immediate pre-symptomatic phase and the kind of half day to 2 days before they get symptoms, and right as they're getting symptoms and like that day after symptoms start, that's when people are the most infectious. So the problem is that you have people that are having COVID infections that don't know it and haven't been diagnosed, and they can spread it to a lot of other people. And that's the reason why wearing masks is so important. Because remember, masks are worn to try to reduce the droplet spread. And people that are infected with COVID and don't know it, they are producing these small droplets that have the virus in it. And if you're close to them and you get exposed, you can breathe those droplets in, and the virus then deposits in the back of your nose and your throat. And then the virus can go from just a few copies of the virus to 10,000 copies in 24 hours. And if it keeps going, it can become hundreds of millions of copies in your blood in the next 2 or 3 days. So the virus can really amplify. And the finding is that you can spread these droplets by just breathing normally, by talking normally, by singing, by panting, by yelling. So that's the reason why staying distance from people is important, and being outside, because the droplets then start to dissipate and reduce their concentration in the outside air. But wearing a face mask, even if it's a homemade face mask that has 2 or 3 layers, or some of the face masks you can buy off Amazon, or some of the ones people are making and distributing, that markedly reduces the droplets that get suspended in the air and reduce the risk of you infecting somebody else if you are in that pre-symptomatic phase. Remember, masks keep you from infecting other people. It's not just them infecting you. So it's really an act of altruism and caring for other people by wearing a mask.
That's so true. I know myself and Doc Fredricks just recorded a video about the importance of wearing masks for guardsmen. Colonel Fredricks and Colonel Heubner, could you talk a little bit? I know a lot of units now, to get a little bit more guard-centric, are starting back for unit training assemblies and individual training periods. Dr. Marsh has kind of already discussed this, but what are the things that we need to be looking at more as we're starting to come together as a National Guard force to get back to a new normal?
When it comes to the National Guard and being able to come in and start resuming our training and doing IDTs and ATs and folks getting ready for deployment, again, just like Dr. Marsh said, it's important for us to realize that when it comes to infectious diseases, there's really 3 things that are key to an infection being able to start. One is the host, the other is the agent, and then the third thing is the environment. And in order to get an infection, you have to kind of have all those 3 things kind of line up together. So from a host standpoint, the biggest thing is trying to be healthy and avoid things that could potentially put you at risk as far as having higher morbidity or mortality from an infection, or specifically with COVID-19, with some of the things that are associated with increased symptomatology and bad outcomes. There's not really a lot that we can do about the agent at this point, specifically because there's no vaccine available or other things that can be used really from a pharmacologic standpoint that's really been shown to make a substantial impact on mortality. So the biggest thing is the environment, and that's where those 3 C's come into play. So again, trying to avoid closed spaces, being able to do training that's outside, being able to be in that outdoor environment where those droplet aerosols, if there is someone who's infected, if they do have droplet aerosols, they get to disperse in the air, and air turbulence can kind of break those up. The other thing is that ambient heat and humidity can help degrade some of those droplet aerosols as well. And then avoiding crowded places. So during drills, you want to try to avoid being in large groups, preferably be in smaller groups, less than 20 people, around folks that you've been around and training with in the past, or folks that you know. Try to avoid mixing crowds with folks from other units or folks that you haven't been in very much contact with recently. And then trying to avoid those close contact settings like Dr. Marsh has said. If you can't socially distance and you have to be in more kind of confined close quarters, then you definitely want to make sure that you're doing things to increase airflow, to break up those droplet particles, and then also make sure that you're wearing a mask, because again, that will decrease the potential of having those droplets being expelled through the mask, or potentially even breathing them in through the mask itself.
Well, the bottom line is, because it's really early in this process, and it's just to cut to the chase, it's the best thing we've got. So our testing isn't awesome. We don't have a vaccine yet. We don't have an easy way of identifying people that have this disease. It's not like SARS or MERS, where people get SARS or MERS and they're sick very quickly and they end up in the hospital. That keeps them from wandering around society and shedding virus, because they usually get so sick so quickly they end up in an ER or an ICU, and so they don't have time to infect people. And so I would just comment too recently on WHO, right? WHO says something, it creates a massive amount of storm on the internet, and they walk back some of that stuff. You've had journals that have had to pull advanced studies back because they can't replicate data. And I like to use the term mob science because there's a desire for people to have information about things that just take time to get really good information about. And so the best thing we have is masks, social distancing, and hygiene. And they're really simple things too, right? So using a mask and realizing everything Dr. Marsh said about droplet control, it's effective. It's worked for 90 years. I pulled a paper the other day from an anesthesiology journal that documented the photographic evidence to surgeons wearing masks in an OR. Surgeons wear masks in ORs not to protect themselves from patients, but to protect patients from themselves. It's the same principle. We're just trying to protect other people from our droplets. And if we all wear masks, then we're doing each other a favor. We're looking after each other. I think Dr. Marsh spoke to this rather well just a few minutes ago. Same thing with social distancing and, learning what 6 feet looks like. Learning that we can have pretty good conversations outside. We don't have to worry as much, especially in summertime. But if we go inside, that we may be protecting someone's grandma at home by watching our distance and making sure surfaces are clean. And just learning to wash our hands really well. I would say that I had a nice conversation with Major Bashar the other day for the podcast I do myself. We talked about how Major Bashar has already seen in his private pulmonology practice a reduction in asthma exacerbations or worsening of asthma in children and adults with COPD with lung infections because they're not as exposed as much as they were before social distancing. Oh, wow. So we can demonstrate that this stuff really works. It's just really hard for people because they're not used to it. We're used to a personal space of about 3 feet. We're used to facing people and eye to eye. We don't like masks. What do people associate masks with? Well, they associate with bank robbers, and like Dr. Marsh talked about. Japan, Asian countries are mask compliant countries. They've gotten used to it for a lot of reasons, but socially they're conditioned to that. And it just takes time to condition people in society to understand that's really important. And believe me, when people don't want to do something, they'll find any reason that they can find not to. And you see that on the internet. All sorts of people citing things that aren't proven just to get out of doing something because it's uncomfortable and it's unpleasant. But it's still the best thing we got. In another year, we'll have a different conversation, right? But right now, it's masks, hygiene, and social distancing.
Those are really good points. I've had the opportunity to ask this question, Clay, to a couple of folks, and it's mainly been a military audience. So I'm excited to get a more civilian opinion on this. But what would you say is the contributing factor to the low infection rate in the state?
Well, I think that there's several reasons for that. We know that the world is very interconnected, and the thinking, as Dr. Fredricks just said, the thinking that we would not see, COVID spread from China, to Europe, to the U.S., to now to South America is really naive because we're so interconnected. And as we see the spread, we see it happen generally in more metropolitan areas to begin with. We know that northern Italy, that is a wealthy part of Italy, and Spain, in the UK and New York, and the bigger cities, San Francisco and California and LA, are the first pass. They are effective because they are more directly interconnected than, say, more rural states like West Virginia. So I think on the first round, even though we do have an incredibly vulnerable population, Kaiser Family Foundation rated it as the most vulnerable, we are not as deeply connected as big urban metropolitan areas, nor do we have the population density in our cities like New York does or Chicago does, or, now as you look at Arizona, they're starting to have problems. So where you have a lot of people that are closely in contact with each other, that's where the COVID virus spreads quickly. So I think West Virginia, we did well because I think the state and the governor made some very good decisions. Not having our students come back for spring break on the colleges and universities, having the schools, stop, having no visitation in the nursing homes, certainly the more aggressive mitigation suppression measures, the stay-at-home order, the shutting down of non-essential businesses, all those made a big difference as well. And I think our citizens were good about watching out for themselves and watching out for each other. I think as we are coming back out again, though, those same benefits, are potentially challenges for us because we did really well, maybe even surprisingly well by some people's estimation on the initial phase of the COVID pandemic. But remember, in the 1918 pandemic, the Spanish flu, it was really the second phase that was a much stronger impact phase where more people died than the first phase. Now, that was complicated because the 1918 pandemic was H1N1 swine flu that basically affected 25 to 40-year-olds, and we were in the middle of World War I. So that was, a lot of people were in close opposition to each other in the war and traveling back and forth. But the 1918 pandemic, as I understand it, led to the death of, an estimated 50 to 100 million people around the world. So we are in maybe the second quarter of a 4-quarter game or maybe halftime. So we need to remember that nobody is spared from this virus. It's a pandemic. And the secondary spread from the urban places that are hit at first, then generally secondarily come to the rural places. So predictably, more rural states and rural places have a higher risk of being affected on this second round. And that's the reason why we've been so consistent in asking people to really pay attention to, the distancing and the hand hygiene, but particularly the face covers, the wearing the mask. So we know that if we get a vaccine, that if the vaccine has enough impact and we get enough people vaccinated, we can drive herd immunity through the vaccine. And if the spread of the COVID virus is approximately, at the time we give the vaccine, is approximately 2 to 2.5, then which means one person infected would infect 2 or 2.5 new people. They would then infect 2.5 new people. And if you do that math, it sounds like, well, that's no big deal. But if you have a single person infected with COVID and the reproduction number is 2, one person infects 2, 2, 4, 4, 8, 4, 8, 16, and you take the doubling time of the virus to 6 days, so 10 doubling times, which would be about 2 months, that one person at a spread rate of one person infecting 2 would have infected 1,024 people. Wow. And then if you don't interrupt that cycle and you take another 2 months, another 10 doubling times, and that one person then in 4 months would have infected 1 million people. That's with an M. And if you take another 4 months or 2 months, another 10 doubling times, and you don't interrupt that whole network, that whole cycle, that one person at 6 months would have infected 1 billion people. That's with a B. So as you keep going, you can see the rate of spread goes logarithmic. And what we're really trying to do is we're trying to stop that rate of spread. And so if you have a vaccine that has an impact to stop the virus, you need to create herd immunity, which means with a reproduction rate of 2.5, you need about 73% of the population to be immune. But masks will get you almost the same benefit. And it doesn't cause herd immunity, but it stops the virus because you're not transmitting anymore. And that reproduction number goes from 2.5 or 2 down to 0.5 or 0.6. It's said that if you have 60% of people wearing 60% effective masks, so the masks are only 60% effective, and only 60% of people wear it, that alone should keep the reproduction number at 1, which means the virus is not stopping, but the virus isn't growing. If you can get up to 80% of people wearing masks that are between 60 and 80% effective, then you can foundationally stop the spread of the virus, just like if you had a vaccine. So what Doc Fredricks was just saying is so important, because we have a solution. We can impact and help reduce deaths, massively reduce deaths, massively reduce illnesses just by wearing a mask. And most people aren't comfortable doing it, but it really has very little risk, and it has a tremendous upside. And that's something that we're really, really imploring our citizens and asking our citizens to do, because by protecting yourself, you protect everybody else. And if we all wear masks, then we should be able to come back safely and continue to have these really low numbers that we have experienced so far.
Can I add something to that too?
Please.
So the other thing that happens along with what Dr. Marsh says is buying time. Every day that goes by, we learn more and more about how this disease works. So for instance, initially there was a whole push for ventilators. Everybody needed ventilators, right? As we learn what SARS-CoV-2, COVID-19 can do to people, that in some people it could be predominantly respiratory. In other people, it's multiple systems, coagulopathy, clots. Every day that goes by, doctors become more aware of how to identify which patients are more critically ill than others. They learn the patterns of this disease. They learn the effective treatments for this disease. And so by just slowing the rate of transmission, it buys physicians and medical professionals and researchers time to be able to effectively treat it when it happens, as opposed to being crushed. Everybody saw the flattening of the curve thing. At that point, in early disease, and again, this is just 2.5, 3 months ago, we were talking about this, not long at all. I mean, a normal paper to publish in a journal, you're looking at 2 to 3 years sometimes to get that data out. And we've been publishing papers in a matter of months, right? Good papers and data take a long time to look at and critically analyze. So every person that wears a mask buys more time. And yes, people will still get infected, but the longer it takes for them to get infected means the more knowledge we have about it, and the more accurately we can diagnose how COVID is affecting them, and we can apply resources appropriately to care for that person and hopefully recover them more effectively.
I was just going to add, just like Dr. Fredricks said, we talked about flattening the curve at the very beginning of the pandemic. And unfortunately, I think a lot of people were under the impression that flattening the curve meant that we were going to decrease the number of cases. It would kind of make its way across the country, and then it would just be gone. And to Dr. Marsh's point, we really need to be prepared in the event that there is a resurgence, that there is a second wave that comes through. And a lot of the measures that are put in place that have been able to flatten the curve are the ones that we're going to need to continue to have in place as far as the 3 C's in order to make sure that we kind of decrease the amount of transmission that we have within the community within West Virginia. Again, like Dr. Fredricks said, in order to buy time so we can get a vaccine, we can get better therapeutics, we can get a better understanding of the disease and the transmission itself. But then also, COVID-19 is around the world. And, with a globalized world, we're going to have people that are going to bring that disease back into the United States, back into West Virginia. So as things open up, we just need to make sure that we keep that in mind as well. So, this is going to be around at least some of these measures that are really good for not just for COVID-19, but also for other respiratory diseases such as influenza. If we had some of these 3 C's put in place back during the influenza season, we probably would have dramatically decreased the amount of influenza that we saw, and probably would have had a more productive force from the National Guard standpoint as far as recommending that people don't come to work necessarily if they're feeling sick, make sure that they do the hygiene and the respiratory etiquette so that you have maybe one person that's out for a while, but you don't lose 30% of your unit within a week because they end up coming down with influenza. So again, I think there's a lot of generalizability with this as far as these 3 C's to other respiratory things. And again, we just need to make sure that we remain vigilant in the event that there may be another wave that comes through.
Dr. Heubner has a great point there, because we have accepted the fact that every year for whatever reason, 30, 40, 50,000 Americans are going to die from flu. What if we did things differently and only 10,000 people died of flu every year? What if, not just because we're trying to control SARS-CoV-2 or COVID-19, what if we control that, but the benefit we get is we don't see 50,000 Americans die from influenza, which is a bad way to die. No, not in a good way. It's just, it's not good. Yet we're learning things that we hope will also pay off in other respiratory illness that has similar transmission patterns. I think that it challenges all of us. If you could save a life through the simple act of wearing a mask, would it be worth it? And again, we're not talking about on your patio in the middle of summer barbecuing steak with your family. We're talking about when you go in the grocery store for 45 minutes. Or we're talking when you have to have an appointment with a group of people or in an office space that's just a little too close. Would you be willing to save a life if all it costs you is wearing a mask? And the second thing I'd like to say about what Dr. Heubner said is we are looking right now at South America. We're looking at Brazil. We're looking at other countries in the Southern Hemisphere because they are 6 months ahead of us. They're going into their winter. And right now we're in summer, which is great. UV radiation probably inactivates COVID-19 pretty rapidly outside. But in 6 months, based upon what we see right now going on in South America, in sub-equatorial Africa, Australia, Indonesia, we can get a pretty good idea of each of those parts of the world and how they approach this disease and what's affected when we hit winter next year. And I think it's really important that people start listening to that when we see perhaps in September, October, based upon what Dr. Marsh is doing on the civilian side, what Dr. Heubner and other folks in the military are doing as far as analysis of this data, if people are saying, look, we are approaching something that could be pretty bad, it's because really smart people have been looking at those trends right now in the southern hemisphere winter and saying, this could be us if we don't change the way we do business. It's really important that people take that seriously. There's so many people working on this that are just devoted to one thing, and that is helping people survive and making sure someone's grandma or some pediatric patient doesn't die unnecessarily from this disease. And it's not a conspiracy. It's the real deal. We have 110,000 Americans that have died from this disease. That blows flu out of the water, and by double at least. And it only happened in a matter of a couple of months. It's really serious.
Wow. I would just say one other thing is that exactly what Dr. Fredricks has said, that at the end of the day, when you look at the world right now, Brazil has the second most number of cases in the entire world. And so as we look at the fall and winter coming, that could be us if we don't make the appropriate moves and the appropriate interventions. And so I think West Virginia has been fantastic. The people have really rallied together. But I do think that the wearing of masks is such an important tool that we have in our solution set. But it is a challenging cultural change for people to adapt. So that's something we really have to work on.
I was just going to say, even outside of the seasonal changes, with people having, closer contact in the winter, looking at resurgence, you look at what's happening right now in Arizona, in the wave that's hit Arizona, and the fact that they've had to have their hospitals now go back to operating their emergency operations cells. I'm not sure the exact numbers, but the number of folks that they have on ventilators right now for COVID-19 are higher than what they had during their initial phase of the response. So again, it's one of those things where, we just have to remain vigilant and mind this, through the rest of the summer going into the wintertime as well.
I think on a hopeful note, and it may just be needing Pollyannish or wanting to see the world through rose-colored glasses. But I think another reason why West Virginia's done well with it, and to some extent Southeast Ohio, is because Appalachians have a very close family connection. It's very easy for a person to relate to an older person in a nursing home that they love or care for. There's a lot of families that are very extended. They know an aunt or a grandpa or somebody, or diabetes, right? It's all over the place. Everybody in this part of the world knows someone who's got some sort of medical illness. And I have a sort of ad hoc study that I go with every day when I drive from Southridge in Charleston, I passed the Sam's Club, and I watched the line of people wearing masks. And if I compare it to what I see in Ohio, I think West Virginians, now it's an unscientific survey, but I'm watching the people in West Virginia, and I see them lining up, and they're using masks, and they're patient, and they realize there's something to this. Even with all the noise and social media working against it, I think that the community nature of Appalachia, West Virginia, is such that people can relate to this and say, is this going to cause someone I care about a big problem if I don't do the right thing? And that's a good thing. That's a really good thing.
I would like to ask Clay your thoughts on the West Virginia Guard and their response to the governor's tasking and all that has gone on since pandemic has started. I'd love to hear, your experiences since all this began, and anything you'd like to share about the Guard.
Well, that one's an easy one for me because the Guard has been, I came into this experience and I've known, Jim Hoyer and some of the other folks in the Guard, and I've had tremendous respect for the Guard for a long time. But since I've been now more shoulder to shoulder, virtually, of course, with the Guard and the Guard's members, including, the two great gentlemen on the phone with me, Kermit Heubner and Todd Fredricks and Wally Hatfield and Russ Crack. I could name so many people that these are not only just spectacular people, and they are spectacular people, and these are really bright people and really committed to the purpose that really, to me, exemplifies the best that we have in West Virginia and also in this country. But they have an incredible ability to become the glue that holds everything together. And I don't mean that as any kind of comment on the lack of talent, because these are incredibly talented people, creative, but the commitment to service and to duty and to helping, the Guard is really the key ingredient that has made this response in West Virginia work. And I know I could ask probably governors of other eras and in other disasters and say, what was the key to making this work? And they would say the Guard. And I could not be prouder as a West Virginian to know that our National Guard is the best group in the country. And I think that that's been consistent for many, many years. And I see the pride of membership, and I see the pride of the craft of what they do. But as opposed to being, a unit that just focuses on military strategy and military deployment, I mean, this is a group of committed people that elevate all around them and do the work that is God's work in helping feed our children, or helping make sure our elderly are safe, or decontaminating places that have become infected, or innovating with the universities and with other people to be able to come up with new ways to test, new ways to produce our personal protective equipment, deploying those, training people. I mean, I can just go on and on and on, and I still probably wouldn't scratch the surface of what this group does every day. So for one West Virginian, to the people on the podcast, but also the people out there, I would say thank you for your service. Thank you for your commitment. Thank you for your excellence. Thank you for agreeing to be people that help elevate everybody around you, because I was really impressed walking into this. I am blown away today. And like I say, I don't even think that I am communicating adequately the scratching the surface, because this is just an incredible group of people. And we are just so fortunate to have them here with us in West Virginia.
Well, thank you, sir. And that is the end of my prepared questions. And what I would ask is I'll go around to each of you. And if you have any final thoughts, I would ask for them. And Clay, I'll go ahead and start with you.
No, I would just say that that certainly for people on the call, I would say it's really important for you each to make sure that you're taking care of yourself. We know that by taking care of yourself and doing the right things that we have talked about on this podcast, and that I know that the Guard is, instructs the membership, that it's really important, because by protecting yourself, you protect your family, your community, the vulnerable people in West Virginia. And also, again, I'll just reinforce what I just finished saying, that I could not be more impressed or more grateful for the service and the excellence of this group in the state of West Virginia. And I found great kinship in the creative part of the Guard as well. And so I know that the state of West Virginia is in good hands, with any administration that has the Guard serving the state underneath them. So thank you.
Colonel Fredricks.
Well, I really am humbled by what Dr. Marsh says about us. I have been in West Virginia Guard for going on about 26 years. I've been all over the state with flood duty. I've been all over the state with other emergencies. And I would just say, I think what he may be saying is that most of us have spent a considerable amount of time overseas participating in the nation's conflicts. And that's sort of a difficult thing to put your head around sometimes, because you don't see a bigger picture. What I know about West Virginia is that I've met people all over the state. I've met people who have lost their homes in floods, who come out and bring water to our folks when they're trying to work or try to give us something that they don't even have to spare. And so when I think about this problem, I think of it as, when I watch the brief every morning and I see another person who's died in the state, I think that may have been that person that took care of us while we were out there trying to help them in a flood and they had nothing. And to me, that becomes a huge challenge to do everything I can to help and nothing I can to interfere with keeping numbers low and not making a mistake that creates division or problems with us managing this as a big team of people, all of whom have very powerful personalities, all of whom are very smart, making sure that we're doing everything we can to make the right steps in the right time and not give people bad information. Those numbers mean something. We watch it every morning. We watch the numbers of how another West Virginian, or a couple of days ago it was 5 and one night it died. And it was powerful because this is very tangible to us. I fought in Iraq. I fought peacekeeping in Kosovo. This is West Virginia. These are real people that I know, and I know that what we do has a direct impact on how they'll be able to live their lives and spend time with their families and go on to the future. And that challenges us every day to try to figure out how do we make it to where they can live with this thing and not suffer from it. And so I'm just thankful that some of that is seen by our civilian leadership in the form of Dr. Marsh and his leadership as the COVID Czar, and that they have confidence that what we're doing is helping.
Colonel Heubner.
So just to echo some with what Doc Frederick said in regards to Dr. Marsh's remarks, I think the National Guard is an amazing organization. In general, I think the West Virginia National Guard has probably some of the best and brightest and most committed folks of any National Guard that there is in the nation. And I think a lot of that goes to leadership that likes to work in complex adaptive systems where there's lots of uncertainty, lots of unknowns, and where we have to be able to make decisions and be able to kind of stick with those decisions, but then adapt as we need to. And so I've seen that in this mission that we've had with COVID-19, from the senior leadership level all the way down to the enlisted level with our privates and our airmen that have been involved in assisting us in making some of those decisions. It's also been great to have an opportunity to work and see how other organizations and agencies in the state can kind of function in an environment that we're somewhat used to working in regards to that complex adaptive system of being in a combat environment with the Department of Health and Human Resources, the emergency management system, the EMS workers, the hospital planners and emergency planners, and our academic partners. It's just been great to see everybody pull together And as Dr. Marsh had mentioned, just the innovation that's come out of West Virginia for a state that has, been placed lower on the resource list nationally with this national crisis. We've been able to, essentially pull out of it and be somewhat self-reliant in a way that I think no other state really has. And it's really been amazing to watch that. So, my guidance and, thoughts for folks that are listening to the podcast would be, with the Guard, we're problem solvers, and people need us to be problem solvers. And so we need to make sure that we're taking care of ourselves, doing these 3 C's, making sure that we stay healthy so that we can be there to step in and assist whenever we're needed.
That's going to do it for today's episode. For more about the West Virginia National Guard, you can find us on the web at www.wvng.mil and stay up to date with all the current news of the West Virginia National Guard and find links to our social media sites. This has been Master Sergeant Eugene Christ with your West Virginia National Guard. Have a great day, and on behalf of the 6,400 Guardsmen in uniform and 700 civilian employees and our families, stay safe and stay West Virginia strong.